Our mission at Orthopedics International is to provide excellent care with the latest techniques available. We go to the major courses that are offered by the Academy of Orthopedic Surgeons, and we also are a staff of instructors at these courses also. And by that way, we are exposed to a number of other surgeons around the world who also deal with these type of problems.
Nancy Ryan knew she had to do something about the chronic trouble and pain she was having in her knee.
About 4 years ago, while on vacation, I took a fall. I sustained an injury to my left knee. After trying therapy and a few other alternatives, it became apparent that I would need surgery, and they discovered that I had actually torn my meniscus.
Nancy is not alone. Thousands of Americans struggle with arthritis in the knees. Nancy turned to Dr. William Lanzer, a board-certified orthopedic surgeon, to help alleviate her pain. Dr. Lanzer and the highly qualified surgeons with Orthopedics International specialize in the most advanced orthopedic techniques, such as this OrthoGlide implant procedure, a minimally invasive implant designed to relieve the chronic, disabling pain brought on by arthritis.
Most people will develop arthritis on the inside part of the knee. We call that the medial compartment. And that's because about 60% of the weight of most people is borne on that part of the knee. So obviously over time, more weight is put on the inside, it tends to wear out more. And that's why this is for the medial compartment, the inside part of the knee. The OrthoGlide basically is an implant that we put in between the two bones that takes up the space that the cartilage, which is missing in arthritis, now it's taken up by the implant. And what that does, it realigns the leg to the proper angle that we need to walk without pain. We've done about 36 implants over the last year and a half, and we've had a very good result in terms of getting people back to normal activities and relief of pain. A good candidate for this procedure would be a patient who had basically failed conservative measures, which include physical therapy, having wedges put on their shoes to change the alignment of the leg, injections of hyaluronic acid, which is a commonly done thing these days, and cortisone injections. When all of those don't work and the patient continues to have pain, that would be a good candidate for this procedure.
The OrthoGlide implant may be placed arthroscopically, and patients can gradually return to higher level activities with significant pain relief.
The main advantage of this implant is basically, you can see, as with other types of implants, this is quite invasive. There's cement and there's a rather large area taken up by metal. In this case, we just replace the cartilage in between the two bones. There's no screws, there's no metal. It's just placed there and it stays hooked behind the back of the bone and it just stays there. And basically the rest of the bone will move across that. And as this wears out, we think it should last at least 10 to 14 years.
Dr. Lanzer performed the OrthoGlide implant in March of 2007, and 2 days later I was walking. It was about 8 weeks, and I was able to resume the activities that I liked the most, including bowling and golfing and walking daily with our pets. The best part about the recovery is that now I move freely and do not even have to think about waiting and unweighting on that knee. It just is pain-free.
Well, it's always nice to see a patient who was basically chair-borne. In other words, have a hard time just walking, being awakened at night, coming in, you can see the change on their face. Normally they have a scowl when they come in, and 3 months later, they're smiling.
A consultant for several orthopedic companies, Dr. Lanzer has also performed over 5,000 hip operations over the last quarter century and continues to help design new, innovative hip replacement procedures.
Well, I'm a firefighter, and I've been active my whole life. As a kid, played a lot of sports, and I was actually out jogging one day and ended up, came down with an injury. And long story short, I wound up finding out that I had bad hips and that at some point I was going to have them replaced, unfortunately a lot sooner than later. And so when I sought out Dr. Lanzer, it worked perfectly. With his history with the Seahawks, his clinic with the Mariners, I felt that it was somebody that would understand, what the demands would be for me and what my capabilities would be to return to the job.
What we find is that with professional athletes, conditioning and physical therapy are the most important factors in rehab. And we find that convincing people that they really need to do physical therapy after an operation makes it a success.
So it's been 6 years now that I had my first hip done, and that's gone great and been back to the job. Now, 6 years later, my left hip kind of reached the point that it had to be fixed, and just had that done 2 months ago and feeling great.
I would rate the level of service I received from Dr. Lanzer and the staff here at Orthopedics International as superior. They were friendly. It was a pleasure to come to the office, and I understood the process all along the way.
I've been extremely satisfied with the service that I've received here with Dr. Lanzer and his staff. Through the whole surgical process, I've always been kept up to date on what's going on. They've just been absolutely wonderful, and specifically for me, they've just given me a new lease on life to be able to not only do the job that I enjoy, but athletics, to be able to enjoy my family. It's just, it's been wonderful. So I wholeheartedly have really appreciated the service Dr. Lanzer has given me.
If you're suffering from arthritis or a type of condition that you have pain and it interferes with your activities, you should try to see if we can help you.
Get back to living pain-free. Contact Orthopedics International for a consultation and see if the OrthoGlide implant is right for you. To learn more, call the number on your screen or log on to orthopedics-intl.net.